Namaskar, I am Dr. Neeraj Goel, Clinical Lead and Senior Consultant, Department of GI Surgery, GI Oncology, HPB and Minimal Access Surgery, Dharamshila, Narayana, Superspeciality Hospital, Vasundhara Enclave, Mayur Vihar. Today we will be discussing acute pancreatitis. What is acute pancreatitis? Before that, we have to understand the function of the pancreas. Pancreas is a gland which is situated in the middle of our abdomen, and it is important for the digestion of almost all of the food materials in our body. Side by side, it is the organ which produces insulin and other hormones. So any inflammation which is affecting this pancreas is the cause of acute pancreatitis, which means that any inflammation of the pancreas will be called as acute pancreatitis. We have chronic pancreatitis also, which is in common terms called as pancreas ki pathri. We are not discussing that. We are into acute pancreatitis. So what are the causes of acute pancreatitis? The main cause of acute pancreatitis is alcohol intake, which is increasing in our country day by day, and we are seeing more and more people coming with the acute pancreatitis. Unfortunately, these acute pancreatitis patients are young. Because of the binge alcohol, these patients are having inflammation of the pancreas. There is release of free radicals which inflames the pancreas, and in turn a cascade effect happens and the inflammation goes on. Side by side, the other causative factors of acute pancreatitis, the most important other factor is gallstones. A gallstone which slips down the bile duct and gets stuck at the exit of the pancreatic duct causes inflammation of the pancreas. When the inflammation of the pancreas occurs, there is the release of the pancreatic enzymes around, which causes the damage to the surrounding organs, and a lots of fluid is released into the abdominal cavity, which cause the symptoms of the acute pancreatitis. So what are the symptoms of the acute pancreatitis? The most common symptoms is the severe pain, which happens in the upper part of the central part of the abdomen, which can radiate to your back. It is associated with vomiting, and very soon it develops into the fever. It can also be associated with, in severe cases, respiratory difficulty, and in very severe cases sometimes kidney will also be affected and patient will be having decreased urine output. So how do we diagnose acute pancreatitis? The diagnosis of the acute pancreatitis is clinical. The patient usually reports to the emergency, where the doctor examines the patient and orders serum amylase and lipase, which are the pancreatic enzymes. Their levels are increased in acute pancreatitis. Side by side, according to the situation of the patients, the other tests are also done. The most important test which is to be done is the CT scan of the abdomen. It is usually done on 4th to 6th day of the disease to see how much part of the pancreas is involved by the pancreatitis and what are the different complications or the accumulation of the fluid inside the body. So how is this pancreatitis treated? Pancreatitis treatment is divided into two parts. One is the early, second the late management. The early management involves the improvement or the taking care of the whole body system. The systemic inflammatory response care is to be taken in this part of the management. The patient is to be given painkillers if required, antibiotics, respiratory support if required, and renal support if required, according to the condition of the patients. Usually the first 7 days of the pancreatitis or the first 10 days of the pancreatitis, acute pancreatitis, are the most critical period. When this period wanes off with a good critical care, the period of the infective complications usually occur. This infection occurs because of the bacterial translocation from the gut to the collected fluid. So we have to take good amount of fluid, good amount of feeding by mouth as much as possible. If we are able to tolerate solids, then it is the best. If not solids, then semi-solids. If not semi-solids, we have to take liquids. The liquids or whatever feed can go into the stomach, can go into your abdomen, into your intestinal tract, is going to prevent the future infective complications of acute pancreatitis. So you have to take good amount of feed. Side by side, the patient is given the antibiotics according to the requirement, and in some cases when the disease becomes severe, there might be requirement of inserting some tubes inside the abdomen under the ultrasound guidance so as to remove the formation of the fluid or the infected material from the abdominal cavity. and sometimes in the very severe cases the surgery may be required, which is the necrosectomy, which can be done both open, that is by giving an incision, or by laparoscopic route. Pancreatitis can sometimes be life threatening, so we have to be aware that we have to remain away from these kind of diseases. But how can we do away from these kind of? By remaining away from alcohol. My message to all of the people is that we should not be taking alcohol. It prevents pancreatitis, which can be life threatening, and also it prevents the cancers which can in future form. So this pancreatitis should not be taken lightly because it can sometimes be life threatening. Thank you.